This conference will now be recorded.
So I with the PEPTA office, we recorded all your questions, and we'll start the discussion with answering those questions. So these are the different questions. I put them into different topics so that we can have a more structured discussion. So the first topic, and there were quite a lot of questions on that, were still questions about the coronavirus itself, but I only answered to the questions which are more or less related to mask. Other questions will be answered another way, not during this session, but probably to some frequent asked questions or a document like this. So there are some more data on viability, and so there were questions about viability on clothes, silver, and so on. And here I put some of the results. So for clothes, for instance, there are some results showing it's 1 day. Actually, it was expressed the way that no virus could be detected on day 2. And for instance, in a number of stores where there are safe clothes, they use that, and they if people touch some clothes in the store, they put them away for at least 1 day. Silver, I didn't find any data. Printed and tissue paper, 3 hours. So the decay on paper seems to be quite rapid. Currency notes, strangely, it's 3 days. Probably because it's less permeable, but actually it seems to be longer. Fruits and vegetables, I didn't find any data. That doesn't mean that there are no data. But I also find data on the outer layer of surgical mask, which is also a smooth surface. In that case, it can stay, the virus can stay alive there for up to 7 days, but at a very, very small concentration. We should always remember the natural decay curve, that the virus decreases very rapidly at first, and then there might still be some viral particles left, but the risk of infection is much less because the concentration is very low and you have very little chance to be infected. And that's probably what is shown in those data. Another thing that we need to remember is that even there are some published data, those data are still insufficient. It's only one study and so on. And also there are possibly some biased data depending on the techniques they use, depending on the detection method and so on. And so we should always be quite careful with those data and apply the precaution principles. And so cleaning and disinfection is really the recommendation that we need to keep in mind in case of doubt. Also remembering that if it's not really disinfection, leaving some object in dry air for quite a long time will also provoke some viral decay, and it will be much safer to use it after that. So there were some other questions about the SARS coronavirus itself. The first one was, is Dettol useful? I answered that it was probably useful as a product that is based on alcohol. I had a reaction from one of you saying that it was not just isopropanol, and indeed, actually Dettol is not just one single product. It's a range of different products, and those products have very different compositions. Some have ethanol, some isopropanol, some xylol, and so on, and always less than 60% alcohol. In addition, there is not a real transparent communication efficacy data. They say it's 99.9% efficacious, but you never know exactly to which product it refers. So I would say that Dettol is probably useful in a household. If you need a product at home and so on, it would probably be useful. But clearly, in a professional setting like hospitals and laboratories where there is a higher risk of infection, including with high concentration of virus and so on, I would really recommend to use 70% ethanol or bleach instead of Dettol. Appropriate concentration of bleach. In one of the two groups, there was also the question there, and I answered, and I saw that somebody else answered a different question. I said that the concentration was supposed to be 1%, Actually, someone mentioned 5%, but the reference was Ebola virus. Ebola virus is extremely hazardous virus, extremely dangerous, and also very, very resistant. And so in the case of Ebola, we would use 5%, but for coronavirus, 1% is clearly enough. Also, the European CDC, for instance, recommends for non-healthcare settings, like again at home and so on, to use much less concentrated products, like 0.05 or 0.1%, so much more diluted bleach. So see, bleach in using 1%, we are really on the safe side, and that's enough for coronavirus. Then the last question about that was transmission from animals to humans. It's not related to mask, except if you work on animals. If, for instance, there are some vaccine testing and so on, and you work in animals, in that case, you need also to protect yourself, for instance. But actually, transmission is not really, it's related, of course, to the animal, but it's mostly related to virus capabilities. So the transmission from animals to humans is probably also through droplets. That means that protection should be done using also appropriate masks. Okay. The next section is on mask. Do we need some translation in Urdu for this, or what do you think, Marshall?
We can, if we get questions, I'll just do it at the end.
Okay. Okay. So the second set of questions are questions on the masks themselves. And so there were questions on the composition of either N95 or surgical mask, and then some about So on this picture, you can see that most N95 masks are made of 3 layers. There is an external layer, which is mostly done in polypropylene, and it's fluid resistant. So if you have some projections, they will kind of flow on the mask and not penetrate the mask, if, for instance, some liquids. Then in yellow, you have the filtration layer, and then you have a softer layer of a fabric inside the mask. And the 2 external layers, outside and inside, are there to shape the mask, and also to the inner one to ensure that there is a good fit of the mask on the face. The filtration layer is made of fibers of polypropylene, so they are kind of mixed fibers, and in some masks there are also some cellulose fibers. And depending on the presence of not of cellulose, they might behave differently when we try to decontaminate them. That's for later. With respect to surgical masks, the composition is also, the structure is also made of 3 layers. There is first an outer layer, which is a non-woven fabric. That's the part which is colored. Someone asked if the blue parts need to be outside. Yes, it's a kind of code that is used. In most masks, the outer layer is kind of greenish or bluish. It's also fluid resistant to some extent. Then you have the middle filtering layer, which is melt-on fibers, but also polypropylene. So it's quite similar from that point of view to an N95 mask. Sorry. And the inner layer is a non-woven fabric, and normally it's white and softer for the face. So the difference there is the thickness of the filtering layer, and also the structure of the mask. This mask does not fit the face, contrary to an N95 mask. Okay. There were 2 other questions about the masks themselves. The first one relates to some masks with staples in it. The question was asked in the 2 groups, and I already answered, but I want to make it clear for the 2 groups. Staples should not be there because it's a default of integrity. At that place, it's a source of leakage, so you have necessarily a lower efficacy. Also, it might pose some problems during decontamination. And so clearly those masks with staples are not standard masks, and they are possibly counterfeit masks, meaning false masks. Some of them, I saw that they were having some some labels on them, some certification labels, but in that case, they are counterfeit. They are not real masks. The second question is from non-disposable mask. My question would be, what type of non-disposable masks? Sorry, there is a mistake there. Cloth masks, they are not standard. There are many different types, and there is no demonstrated efficacy. So it will depend a lot on the mask, but I will discuss a little bit about that later. With the other types of non-disposable masks, like the respirators, like the one represented on the bottom left, in that case, those are protective against a number of things. It will depend on the cartridge that are fixed there. If the cartridge is equipped with P3 filters, in that case, there will be efficacious against viral particles and aerosol droplets. Anyway, one thing which is important with all the reusable masks, there is a need to frequently clean them or disinfect them. It's true for the cloth mask, and it's also true for that kind of elastomeric respirators and so on. They need to be regularly cleaned or disinfected after each use, or at least once a day for the respirators. The third part, the third series of questions are about wearing a normal use of masks. And I propose that we have a summary after this in Urdu, and perhaps see if you have additional questions. So the first questions relate to do we need to wear a mask? Actually, the decision to wear a mask needs to be based on some kind of risk assessment. I don't mean that you need to produce a report on risk assessment, but that you need to really think about risk. Is there a risk or not? If there is a risk of transmission or aerosol dissemination, infectious aerosol dissemination and so on, in that case, you should really consider wearing a mask. And actually wearing a mask could have two objectives depending on the situation. The first objective would be to protect the people in high-risk situation, meaning to protect the people who wear the mask, to be protected from aerosols. And that it's the case for healthcare workers, especially if they work in a COVID environment, in COVID units, for instance. First-line rescuers also, laboratory staff, if there are no suitable biosafety cabinet available. Okay, but that's really to protect the workers, I would say. But a second objective could be to limit the dissemination of the virus. And that's the case, for instance, for the mask that we put on patients or suspected case. We don't want them to spread the virus and possibly to contaminate the environment and infect other people. Also, there were questions about wearing a mask in public. Actually, there is also the interest to protect the wearer and limit the virus dissemination. And for instance, masks could be and are even in Europe now generally recommended when physical distance cannot be maintained. I remind you from the first session that the distance is quite important, and there are some rules of maintain some distance and so on. In some situations, we cannot keep that distance, and in that case, it's very useful to have some kind of mask. It's true in public transportation, for instance, if we share a taxi, on public markets, in stores, and so on. There was also one question about wearing a mask in the open, when alone in the open space, like walking in nature or something like that. There is absolutely no reason for that. Actually, the spread of the dissemination of the virus, there is a very strong dilution and so on. So if you are not close to people, there is no risk of transmission by aerosols. Also, it's better to save your mask. Sometimes we see people who are alone in their car, for instance, they wear a mask. It's totally useless. And so if you don't really need it, if there is no risk, you should not wear them and spare them for high-risk situations. Now, what type of mask should be worn by what type of persons? I told you that it has to be risk-based. So the most exposed people should have the most protective masks. It's a case for healthcare workers, laboratory staff, and so on. And in that case, they should definitely wear N95 mask or similar mask if they are available. in the COVID context, and I insisted on that during first session, they should be non-valve. So the picture on the right with a valve there, that should be excluded. Why? Because the workers could also be infected, and in that case, they would contaminate, infect their colleagues and patients and so on. So for the most exposed people, like in healthcare environments, in laboratories and so on, non-valve N95. Then for patient and suspected case, surgical masks are the ideal mask, I would say, the most recommended masks. For the general public, cloth mask, that's, I would say, it's the rule, because we don't want to spend resource, I mean, to kind of lose a highly protective mask for a very low risk situation, or possibly surgical mask if there is no mask storage. And I insist on that last sentence. So clearly, those masks should be worn by the right person, and it is very, very important to make sure that the most protective masks go to the most exposed people, especially in a situation of shortage. If we don't have enough masks, we should really dedicate the ones which are the most protective to the most exposed. Some other questions about wearing and normal use of mask. First, is using a surgical mask inside an N95 mask recommended? Definitely not. It's not recommended at all, because if you put a surgical mask inside, you will lose the tight fitting of the 95. So you might end up less protected than what you wish. And there is no reason for this, since non-valve N95 also protects others from possible infection from the people who are wearing it. So definitely this is not recommended, and it's the opposite. It should not be done. The interest of wearing two surgical masks, one over the other, actually I don't see any significant additional protection of having two masks, one over the other. And also, there will still be a need to change the inner mask at the same frequency. So there is no real benefit. I don't see any real benefit of doing that. If you need more protection, then it would probably be better to have a more protective mask, such as N95. And then the last question is about that issue of fitting, poor fitting of masks on people who have a beard. And there were a few questions about that, and one said besides paper, because paper don't have that drawback. I mean, they would protect even someone with a beard. The problem is that they are very expensive and not accessible in most situations, I would say. So I see three different possibilities, but there is no ideal situation. I tell you right away. One is about the behavior. You could, if you have a heavy beard, for instance, in that case you could avoid high-risk situation. That's what we would do in Europe if there is someone who is working in an environment where there is a high risk of being exposed to some infectious aerosols. In that case, the decision would be to take that person away to that high-risk environment, or that person should shave. But that's just what we do in Europe. Perhaps this is not something which is applicable in Pakistan. One solution that I've seen in some cases is, it's not ideal, but it probably improves the situation, is to put a mask normally, and then you put some tape around the edge to have it stick closer to your skin, and in some way there would be less risk of escape or introduction of particles at that level. Dr. Ziba some time ago also sent me an article about using nylon stockings to really make surgical mask tight. This could possibly be also applied to N95 on someone who wears a beard. I don't know about this, and I don't know if you find that very easily in Pakistan. Of course, there is a drastic situation of shaving, but also possibly to modify the shape of the beard. It's not really satisfying for most of you, I guess, but I found this on the net, and actually this is published by the US CDC, and it's about the different types of facial hair, could be birds, or mustaches, and the ones that would be suitable for wearing a N95 mask. Of course, that might not be the taste of the people who wear a beard in Pakistan. So, but I still wanted to share you this. Mashal, would you want to make a summary now?
Yes, Phillipe, thank you.
Okay.
So,
how should we proceed?
I'm going to send you a request. Oh.
Yes.
It's not going through. What I can do is I'll just summarize. And in the meantime, if you can just send me this presentation while I'm doing that for the next section.
Okay. Okay, I will try to send it to you right now. But perhaps yeah, I will try to send it, but perhaps if you don't have it early enough, you can just say next, and I will move from one side to slide it to the other. Okay.
Okay, that's fine as well if you want to do that right now.
Yeah, yes.
Okay. जब तक फिलिप वो करते हैं हम समरी शुरू कर देते हैं इन सेक्शन ये आज के सेशन में हम बेसिकली आपके सारे क्वेश्चंस आंसर करेंगे शुरू में हमने बात की डिसइंफेक्टेंट्स की फॉर एग्जांपल किसी ने कोविड रिलेटेड पूछा था कि डेटॉल का इस्तेमाल हो सकता है उसमें हमने ये देखा था कि डेटॉल घर के अंदर हाउस होल्ड लो रिस्क एरियाज के लिए ठीक है लेकिन हेल्थ केयर सेटिंग्स के लिए रिकमेंडेशन अभी भी है कि आप एटलीस्ट 70% अल्कोहल का इस्तेमाल करें द नेक्स्ट हमने फिर क्लॉथ मास्क की थोड़ी सी बात की थी क्लॉथ मास्क में डिफरेंट वैरायटीज प्रेजेंट होती हैं एंड जनरली अगर दो कपड़ों के दरमियान फिल्टर हो वो वाला क्लॉथ मास्क सबसे बेहतर यूज के लिए फिर हमने थोड़ा सा देखा था कि मास्क पहनने की जरूरत है या नहीं हाई रिस्क सिचुएशंस के अंदर बिल्कुल जरूरत है हाई रिस्क सिचुएशंस इंक्लूड होते हैं हेल्थ केयर सेटिंग्स फॉर एग्जांपल हॉस्पिटल्स जहाँ पे कोविड के पेशेंट्स ट्रीट हो रहे हो या फिर लैबोरेटरीज जहाँ पे कोविड की टेस्टिंग हो रही हो उन एरियाज में जरूरी है कि आप मास्क पहने और अदरवाइज आपने रिस्क असेसमेंट करके देखना है कि आपको मास्क कितने की जरूरत है मास्क आप देखना चाह रहे हैं कि पर्पस बेसिकली क्या है पर्पस ये है कि आप जितना वायरस फैले उसको आप कम करना चाह रहे हैं तो अगर नॉर्मल लो रिस्क सेटिंग्स में अगर फिजिकल डिस्टेंस अगर मास्क की शॉर्टेज है और अवेलेबिलिटी नहीं है और आप तब आप फिजिकल डिस्टेंसिंग करके भी कोशिश करें कि आप के अंदर डिसमिनेशन का चांस कम हो कि वायरस हमने पहले लेक्चर में देखा था कितना दूर ट्रैवल करते करते बहुत डाइल्यूट हो जाती है तो रिस्क इन्फेक्शन का कम होता जाता है तो अगर आप लोन है तो फिर किसी ने पूछा था कि अगर हम अकेले हम मास्क पहने उस सिचुएशन में मास्क पहनने की इतनी जरूरत नहीं है स्पेशली आप जब देख रहे हैं कि वर्ल्ड ओवर मास्क शॉर्टेजेस है अगर आप अकेले हैं ना किसी को आपसे इन्फेक्ट होने का चांस है ना आपको किसी से इन्फेक्ट होने का चांस है तो उस कंडीशंस में रिस्क असेसमेंट के तौर पे तुक नहीं बनती कि आप मास्क पहने फिर उन्होंने पूछा कि कौन सा मास्क किस टाइम पे कब पहने N95 मास्क जो हैं वो लोग पहने जो सबसे ज्यादा एक्सपोज्ड हैं जिस तरह हमने बोला हेल्थ केयर सेटिंग्स में जो लोग काम कर रहे हैं वो वैल्व मास्क ना पहने क्योंकि हमने लास्ट लेक्चर में जिस तरह देखा था वैल्व मास्क सिर्फ वन वे प्रोटेक्शन ऑफर करती है यानी कि वो सिर्फ आपको प्रोटेक्ट कर रही है अगर आप इन्फेक्टेड हैं वैल से वायरस तब भी एक्सहेल हो सकता है तो वो रिकमेंडेड नहीं है अगर पेशेंट है या फिर कोई सस्पेक्टेड केस है उस इन दैट केस सर्जिकल मास्क पहनना इज ओके क्योंकि वो वायरस को ट्रैप कर देगा और बाइंड नहीं जाएगा एंड जनरल पब्लिक में उन्होंने कहा कि क्लॉथ मास्क या सर्जिकल मास्क पहने सर्जिकल मास्क अगर अवेलेबल है अगर नहीं क्लॉथ मास्क पहनने लेकिन अगेन थोड़ी सी रिस्क असेसमेंट आप खुद भी कर सकते हैं और देख सकते हैं कि कितनी जरूरत है या नहीं फिर हमने थोड़ी सी बात की थी डबल लेयरिंग की अगर एक सर्जिकल मास्क पहने और ऊपर N95 पहने ये पहनना एक्चुअली काउंटर प्रोडक्टिव होगा इससे ज्यादा नुकसान है बिकॉज इससे बेसिकली आप अपनी फिटिंग खराब कर रहे हैं N95 की फिटिंग खराब करें एंड वो बहुत जरूरी है उसकी परफॉर्मेंस को ऑप्टिमम रखने के लिए सर्जिकल मास्क की डबल लेयरिंग की भी यही बात थी इसमें सच जरूरत नहीं है फिर हमने तो थोड़ी सी टच किया था टॉपिक के अगर बियर्ड हो तो वो बंदा क्या कर सकता है अगर N95 की फिटिंग प्रॉपरली दाढ़ी की वजह से नहीं हो रही उसके अंदर उन्होंने 3 sort of solutions दिए थे। एक कि आप behavioral solutions अगर आप बीएड है और आप एक एसेंशियल वर्कर नहीं है, अगर आप हेल्थ केयर में काम नहीं कर रहे, तो आप ऐसे हाई रिस्क एरिया में मत जाएं जहां पे आपको एक्सपोजर का चांस होगा, इवन तो अगर आपने मास्क पहना हुआ है। दूसरा उन्होंने कहा था एक पॉसिबल सोल्यूशन है कि आप टेप करके अपनी N95 को ज्यादा क्लोजर फिट कर सकें ताकि वो एक्सपोजर का एरिया कम हो जाए। एंड तीसरा उन्होंने थोड़ी सी पोटेंशियल सॉल्यूशंस दी थी, आप अपनी दाढ़ी को ट्रिम किस तरह कर सकते हैं उसके शेप को मॉडिफाई करने के लिए। एंड अब हम आपके क्वेश्चंस लेंगे। डॉक्टर ज़ीबा, will you be doing the Q&A?
Yes, I can do the Q&A.
Thank you.
Are there any questions right now? If you have any questions, please put them in the chat box. If we don't have any questions, then Phillipe, I think you can go on, and then hopefully by that time we'll have some questions in the chat box.
Dr. Ziba, I think a few people have accidentally private messaged me questions, so I'm just going to read them out loud.
All right.
Is there a difference between the KN95 and the N95?
It's. I was going to answer later, but I can do it now. The standards are very similar, and so both are effective, efficacious more than 95%. So normally we should consider that KN95 are similar and or identical to N95. Actually, the problem is not really there. It's it's an issue with possibly counterfeit masks. Most of the time, if it's most of the Chinese masks, for instance, that are sent to the West, especially to Europe or to the US, are before years ago they were certified against the US standard or the European standard. And most of the time, the certification was done by a European or an American certification body. Now, and especially in that situation of mask shortage, we get many masks which are certified according to KN95, but which are also certified by Chinese companies that we don't know. And of course, in relation to possibly counterfeit masks, some of those companies do not even exist, meaning that some masks have a KN95 label, possibly some documentation with the name of a Chinese certifier, but we don't even know if that certifier exists. And so I would prefer to have a N95 mask certified as N95 according to the US standards or European standard, and certified by some Western company in the current context, because I mean there are some cheating there. Sorry for this long answer to that question, but I think it's critical that if we pay to have protective masks, that they are really protective, and there are some cheating clearly.
Okay. Another question we have, Phillipe, is a valved mask recommended for a COVID PCR lab health worker?
Okay, interesting question about PCR actually. Actually, when we do PCR, we only deal with the virus or with something which is infectious during the first step, when you extract the RNA, okay? And during that step, of course, there is a risk of infection. But then when we have the RNA which is extracted, there is no infectious risk anymore. We need to protect the nucleic acid for any external contamination. So for that, we don't need any mask anymore. But of course, that's depend on the setting. If you do everything in the same lab, then it's better than everybody wears a mask in that lab. If you have a nice PCR suite, as it should normally be, with one extraction room, then one preparation room and one reading room, in that case, you only wear mask in the extraction rooms and for the rest there is no risk, and so you should not wear a mask. So it's a little bit, yeah. So clearly, if you do all the PCR steps in the same room, in that case, you should wear a mask. If you do the preparation and the reading in another lab, in that case, you should not wear a mask in those labs.
Philippe, we have a few questions about disinfection of the N95, but I know you have a whole section on that, so
Yeah.
we won't address that right now. We have one more question. What about wrapping a scarf around the face in an absence of a mask?
Okay. It's also coming a little bit later. It depends on the scarf, because you could have very heavy scarves. You can have scarves with fabrics which is kind of loosely woven, or some which are much more tight. So it depends a lot on the quality. It's about like with some cloth mask. It depends on the type of fabric that is used. But generally, scarves are not made for any type of protection. So the people who make them, they choose the fabric according to the color, to the nice texture and so on, but not thinking about filtering characteristics. And the result of that is that most scarves do not protect and are not protect very much, actually, because it's not their purpose, and nobody chooses the fabric with that idea in mind.
Okay, one last question for this section. The outer part of a surgical mask should go inside or outside for protecting from the virus. If someone has nasal congestion, how should he wear it?
Okay, could you repeat, please?
They're asking if the darker part of the mask should be inside or outside.
Okay, I will cover.
And if someone has nasal congestion, problem breathing through their nose, how should he wear it?
N95 or surgical? Surgical.
It's surgical.
Okay. I propose to go through this section because the answer to the first question will be answered there, and then if needed, I can answer the second part of the question. Is that okay?
Okay, great. Yep, perfect.
Okay. So now we'll talk about reuse. Oh no, wait. I'm a little bit. No, okay. I will answer now. Sorry.
But that's okay.
Sorry. So clearly, the structure of the surgical mask, the kind of impervious part should be outside, and there is a code that is used. It's the bluish or greenish part. Okay. The inside part of the mask, it's a little bit absorbing, and of course, someone who has some rhinitis and so on, the mask will be very rapidly humid and will be not comfortable to wear, and in that case, it must be changed. That's a situation where, of course, you need to change mask much more often than it's planned. Also, in that case, if you need to, you might need to remove the mask just to take care, because you need to take care of your nose, and in that case, it's also a risk situation for the others. So I would say that if you have really like temporary infection or rhinitis or something like that, and you have nose problems, I would not recommend you to work in your normal environment where other people could be exposed, and especially in the COVID situation. In some settings, like production settings and so on, as soon as you have such a problem, you don't need to work in labs anymore. And so I would avoid that, because it's really a possible exposure to others, but also for to be exposed ourselves to COVID, for instance, if we work in such a context. Is that okay? Did I really answer the question? I mean.
I think so. If anyone has any follow-up questions, they'll just put them in the chat box.
Okay. Did you receive the sending email?
Not yet, Philippe.
Okay, perhaps it's too heavy. Okay, so now we'll speak specifically about reuse of mask or prolonged use of mask, and the questions that were asked there. Duration of wearing an N95 or surgical mask. Actually, all the current N95 and surgical masks are all disposable masks. So they are supposed to be disposable. They are sold as disposable masks. And so the official recommendation from the manufacturer's notice and authority and the authorities is 8 hours. That's kind of official. 8 hours meaning that you could wear it the whole day long, or possibly use it over a few days, but not more than 8 hours officially. And then it should also be changed when damaged and or overly soiled. And that's the situation where someone has some kind of rhinitis or a problem like that. But actually, there are also some new and conflicting information. First, there are a few papers showing that the filtering capacity, the decrease of the filtering capacity, is minimal after days of heavy use in normal life. So the picture you see there, that's a study that was made in Asia, where people wear such masks on the street. And actually, in that case, you see on the left column that a new mask protects of that type, 3M, this specific model, whereas has a protection factor of 99.7%. After 11 days of use in normal life, the protection was still 98.3%. Of course, in normal life, they are not exposed to a lot to viruses and so on, but to a number of things, including dust and so on. And that means that if you keep the capacity after more than 10 days in such a situation, there is no reason why you should not wear such mask for a longer time in laboratories. I say that it's in some way it's opposite to the business of selling masks, and of course opposite to the official recommendation, and no official body would say that as I can say it. But I think that if we don't have enough masks and we don't have yet a good way to decontaminate them, we could really take the risk to use them for a longer time than just one day. It's certainly better than using a less protective mask, for instance, which will not even reach 90% of protection, okay? And then there are also ways to prolong the wearing time of a 995 mask. The first way is to wear an over mask, and it could be a surgical mask or a cloth mask. The interest of that, it will not really increase protection, but it will at least absorb the largest dust and or aerosol particles. They will stop by the first mask. And because of that, the filtering media of the second mask, of the N95 mask, will kind of be spared, and you can use it longer. This is an experience that one colleague of mine here in Belgium used in Africa, where during Ebola epidemic, I mean, and in that case, they were prolonging the mask in always wearing a surgical mask above the N95 mask. And they were wearing such masks for at least 1 week doing that. And then the other options are decontamination and reuse, but that will be a different chapter, and I will explain that a little bit more in a few minutes. There were other questions, and these two are somewhat related. How many times should the N95 mask be worn, and is it recommended to don and doff N95 mask according to the needs for prolonged use? My answer to that is, in principle and according to most recommendation, is no. Why? Because donning and doffing implies some risk of contamination. In doing that, you are taking the risk of spreading the virus, of contaminating your gloves, your hands, and so on. Also, if for N95 masks, fitting properties are important. So in touching it too much and so on, you might deteriorate the fitting properties. However, it should still be considered if you are really exposed at different times. So, for instance, some medical doctors who visit patients a few times a day, and the rest of the time are only not directly exposed and so on. Of course, they should not wear the mask all the time. It will be sparing the mask if they only wear it when they get exposed. But of course, if they do that, they need to really use the proper donning and doffing procedure, be very careful in doing that. And in any case, when you are doffing, when you are taking your mask off, you should always wash your hands after that with water and soap. And could it be done many times? I think anyways, you can do it a number of times. There are some data that says that there is no alteration of anything after 5 or 10 donning and doffing steps. Actually, it may even be more if you see the data I just presented on multiple day use, like people using masks on 10 days. Of course, they don't sleep with them, and so they always take it off and put it back and so on. And still, the protection of 98% and so were still maintained. So I would say that we can wear them a number of times if we, for instance, if we do intermittent use. Two other masks about this topic, two other questions about this topic. How useful is it to use tissue paper inside a mask for prolonged use? Actually, I was wondering about the question, what type of mask? If it's a 995, you should definitely not do that. There is no interest in putting some paper tissue inside, for instance, you might compromise the fitting. So definitely there is no need for that, but it could also be a hazardous practice to do it. In surgical mask, I don't really see the interest because the filtrating media is already there, and you will not really improve the filtration capacity in adding some paper. And anyway, it will not filter enough so that you can spare the mask. With cloth mask, that's maybe different, especially with some models, and I think that those are possibly the best models. Models where you have actually 2 layers of fabric, that's the cloth mask, but in between those 2 layers of fabrics, you can insert some filtering materials. And in that case, you can put some tissue paper, for instance, and in that case, that will help filtering. And this is something that you could remove and discard very easily. How to reuse N95 mask? I would say only after decontamination or viral decay, and if they are not damaged, and that's always important. But that's for the next chapter. Do you have any question on this part already, or should we go to the next chapter now?
I think you should go on now because we only have about 12 minutes.
Okay, so I will speed up a little bit because these are the questions. Actually, one thing which is important, if we think about the requirements for the decontamination of N95 mask, we need to consider a number of things, and those are really conditions that are absolutely necessary if we want to consider some technique to decontaminate N95 mask. Of course, it needs to be efficacious against the virus. It should really reduce the virus load in a significant way. We need to preserve the filtration performance of the mask, and also the structure and face fit. And then we should not introduce any additional hazard, for instance, from chemical disinfectants. There are 2 main types of decontamination options, and that I will go through very quickly, some physical techniques and some chemical techniques. So UV radiation, that's used, and it's quite a lot in our countries. In that case, it's apparently relatively simple, but it's more complex because you need to really expose all faces. The main problem is that UV are only decontaminate the surface, and so the filtering media inside will not be decontaminated. So to me, there is an issue there, even if it's something which is in quite a lot of development for the moment. Autoclaving, it should be rejected because there is a degradation and loss of the filtering and fitting performance. So rejected. Dry heat treatment also is less. It's less efficient, so low performance, but also poor efficacy. And if we increase the temperature, it will also have some problem of degradation of performances. Microwave treatment, and in that case, it's not so complicated. It would be in a kind of kitchen microwave oven. It seems to be interesting. It works, especially if we use it together with some water, so that it's a wet treatment. But there are still too limited data. And some type of masks also lose their performances. So it might be a possibly good option, but it needs further testing and developments. Washing, a number of people have tried that in a laundry machine, for instance. Actually, it's also rejected because there are limited efficacy data, but mainly because many masks lose their performances. Natural viral decay. So remember, remember that the virus decreases very rapidly, and so we could use this, even if it's not a decontamination treatment, but have a kind of rotation of masks. Use one mask like one day, leave it for 4 days, and in the meantime use another one, and so on. And in that case, it would be a quite cheap and easy solution with the really advantage that there is no loss of the performances. That you don't really affect the mask. There are still too limited data on this. We need to control the parameters, so like humidity and so on need to be controlled, temperature and so on, and you need for logistics. It needs some further developments, but it's possibly a very interesting and sustainable solution. Alcohol, rejected because there is quite a lot of degradation of the filtering and filtering performance. Bleach, same thing, also rejected. VHP. This is also one option that is being much developed in the US and in Europe. It works, and it works pretty well. The problem is that it requires quite sophisticated equipment to generate the hydrogen peroxide vapor, and also a room with very specific conditions of temperature and humidity. So it will probably only be accessible to high resource settings. So what could be considered for Pakistan? I would say that in my mind, natural viral decay would come first. For instance, based on a 5-day rotation. Of course, the mask should be marked in that case with the name of the person wears and also with an indication of the date. Microwave, VHP, UV radiation could also be considered, but there are a lot of need for further development and testing. And the most accessible, most sustainable is probably natural viral decay. One message there, which is important, is that in any case, due to the diversity of the models of N95 mask and also to the specific context of use, including for natural viral decay, temperature, for instance, and humidity, you always need to have some specific local testing before you implement one of those solutions. You need to do it at your institution with your own masks. You can find some more information on a kind of review I made of the different techniques with some references. Okay, quickly to the rest now. About cloth masks, are cloth masks really safe against COVID-19? Actually, there is no standard. There are many different models and there is no performance testing. So there is no established or guaranteed efficacy. But still, such masks are a barrier, which may be quite effective depending on the structure and composition. And they certainly offer some protection in both ways. So they have some interest to limit the virus dissemination in the community. And this explains partly why Southeast Asia, where they're used to wear such masks in normal life, virus dissemination was much less than in Europe, for instance. So in wearing some cloth masks like that, actually we have a double barrier. So if you are in a community, like working in a city and so on, some people, all the people wear a mask. If someone sneezes or coughs, in that case, there will be a first barrier there that will stop many of those particles, not all of them, but also for the people who are crossing by, they will also be protected from what could escape the first mask. So it's a double protection. And looking at the community as a whole, it has indeed some benefit, I would say. Yeah, the picture on the right-hand side is the mask with where we can insert some materials there, and actually there are a few studies that show what happens there, that show the filtering capacity of materials that could be used. On the top you have surgical masks, but then you have different types of like cotton and so on that you could find in common life. You can see scarves also, which is quite low. Silk is even lower, but there are some like some good media, like for instance the vacuum bag, cleaner bag. If you cut that and you put that inside a mask, you have a good filtering media. You probably don't use that much in Pakistan, but a filter for coffee, for instance, can also be used. There are some different studies, and the reference I put down on the slide, you will find some other reference about filtering materials, especially for cloth masks. These are quick ones. How does one safely sterilize or clean a cloth mask? That's very easy. Washing with soap or detergent at 60 degrees, either by hand or in a laundry machine. Are there any data available on cloth mask efficacy? No, there are too many models, and obviously nobody was too interested in doing that. I don't know at least any data available, but even if someone makes a study there, conduct a study there, it will be very difficult to extrapolate that to the different types of masks. Counterfeit and poor quality mask. I think that this is a real issue. It's an issue in Europe. We have had lots of counterfeit masks arriving from being imported here. And I think I answered the second question already. So this is finished for the part on or at least on those questions. So if there are any additional questions, I'm ready. Michelle?
Yes, Philippe. We don't have any additional questions in the chat box.
Actually, there are quite a few questions that came earlier. I think, Philippe, you have answered most of them, but there's one here that says, if an N95 mask gets wet by sweating, will it be useful? So if it is very hot and the wearer is sweating and the N95 mask gets wet, will it be useful?
I think I'm not totally sure of my answer, but it's based on my experience and few readings. I would say that as long as it's not completely soaked with humidity, it would be usable. But yeah, if it's completely soaked, in that case, we will clearly lose the filtering capacity. But I don't know if it's for in between steps. So I would avoid to have that and probably change them or consider some other option. For people who are in a very hot environment outside of a COVID context or a hospital context, like workers in workplace exposed to dust and so on, they wear a mask with a valve. That's the purpose of the valve, to avoid that. In this case, I think it should be okay to some point, but I don't have more information. Mm-hmm. And it's an important question, especially in Pakistan, I know. Anyways, if you have questions like that after this session, you could still probably send them to PEPSA, and we can do some research and try to also join them to most frequent questions or some document like this. Because I want to explore this a little bit more because I'm not satisfied by my answer there.
So there's two important points Philippe brought up. One is that there's lots and lots of work going on masks right now. And we were both at a session for 2 hours this weekend about masks. It was more focused on developed or higher resource countries, but we can send you the link for that. So anybody who's interested, there's an organization on N95 masks and decontamination. Philippe has produced a nice document on masks, and that is up on the PEPSA website as a link, I believe. And secondly, we will have more answers on the frequently asked questions section in the PEPSA website, which is on resources. And finally, if there are a few more questions, I think you've answered most of them, Phillipe, but don't hesitate. And if you feel it would be useful to have another session on questions that haven't been answered, please let us know. Here's another question, Phillipe. It's the filter layer in the N95. Is the electrostatic charge on it? How will it be removed? How to reintroduce it? How to check if the charge is there?
Yeah, it cannot be reintroduced. So if it's lost, it's lost. And that's the main reason why some treatment deteriorate the filtration capacity. For instance, alcohol, because it's a solvent, will destroy that electrostatic load. Bleach, it's more than just that, but it also destroys that electrostatic charge. So actually, it's when testing different decontamination methods, we always need to test the filtering capacity and the fitting capacity. Most of the time, the filtering capacity is lost because we lose that electrostatic charge of the mask. And if the mask is completely wet, it will probably also be the case. So that's a reason why it would lose at least part of its filtration performances.
Okay, everybody, thank you very much for your participation. This session has been recorded, and so it will be up on the PEPSA YouTube channel within the next couple of days. And as Dr. Phillipe said, any more questions, please go ahead and Dr. Mashal or Shiroz. Thank you very much, Phillipe. And thank you to everybody who stayed on till 6 o'clock in the evening, Pakistan time.
Yeah, thank you very much. Yeah, and of course, we don't have a solution for everything, and things are still moving. So we should keep asking questions and trying to find solutions. And that's a team work, I would say. Thank you very much.
Okay, good.